November has been dubbed the darkest month that Kenya has witnessed since the pandemic struck in March. Now this month, the country has recorded 15,852 positive cases and 289 deaths from COVID-19. But despite these grim statistics, many Kenyans still continue to drop their guard, disregarding the containment measures and questioning whether or not COVID-19 is a reality. Well, tonight, Dorcas Wangira examines what continues to be the weakest link in our country's fight against COVID-19, an attitude of skepticism and the lack of behavioral change.
COVID-19 has cast a dark shadow over Kenya, with its attendant trail of death, grief and devastation. In this month alone, 15,852 people have been infected and 289 have died.
This has been the darkest month since March. Although we have lost so many, we must not forget that we are at a war.
It's not an easy matter fighting an unseen enemy, especially if it's a viral disease like COVID-19. Anyone walking here in Nyeri town could be infected and in turn infect someone else who could infect someone else. But despite this danger, not everyone wears a mask in public, and even those who have them do not wear them properly. Social distancing is not observed as people interact freely. In the marketplace, it may be business as usual, but most traders and customers we see adhere to the containment measures, treading carefully. The county has recorded 39 new positive cases Tuesday.
Watu wanasema kuna corona na tumeona sasa wamekufa wengi. Kama hapa kwa Manji kulikufa mkubwa wa Manji, tukasikia ni corona, tutamuona lakini tulisikia ni corona.
Wacha kuleta mambo yako. Wale watu wanasema hakuna corona. Mimi nataka kusema corona iko juu, tumeona watu wamekufa.
Kila mtu ashukulia hii jambo likiwa lake.
The biggest challenge in containing the virus is a don't-care attitude among the citizenry. While a part of the population strives to protect themselves, others don't. For example, this situation in Kajiado County. In Kayole, in Nairobi's metropolis, we witness a similar scenario. This man isn't wearing a mask. He then gets into a matatu where there are other passengers. No sanitizing at the point of entry, as it was at the onset of the pandemic. Likewise, motorcycle passengers and riders also have no masks. We continue to spot more residents walking in public spaces without masks as well, both young and old. In one of the workshops we meet men hard at work, the pandemic has badly affected business, causing a lot of financial strain. But despite the grim picture painted of double-digit deaths reported, it's business as usual.
Na watu wanaamini iko na kuna wengine wanaamini haiko. Yani in short form ni scam yani.
Sana watu waba. Wanasema ate corona kuna mara president amekataa kufungua nchi.
Haiwezi isha hivi karibuni kwa sababu rege BBI bado inaongelewa. Mambo inaendelea.
Nairobi still remains the epicenter for the virus, having the highest attack rate. It's the place in this country where you have the highest chance of contracting the virus. In Kenya, masking is mandatory, and not wearing a mask in public spaces could earn you either a fine of 20,000 shillings or a jail term of no less than 6 months. The rationale being that a mask protects you from infection. But here, like most parts of Kenya, masks are worn for another reason, notwithstanding the stiff penalty.
Kusema kweli hapa panaliko tunavaa mask kwa sababu ya polisi. Wanatushika, hiyo pesa wanachukua na wanaweka kwa mfuko.
At the time of an outbreak of an infectious disease, there's always the likelihood of an infodemic, where people do not get accurate information about the disease itself. COVID-19 is no exception. Another time of the pandemic, rumors and fears have spread, changing people's perception of the virus. This largely influences people's attitudes and behavior. Nonetheless, the proof of the potency of the pandemic is in the trail of infections, death, and devastation. Dorcas Wangira, Citizen TV, Nairobi.